look at the research on homelessness among veterans, it's hard to pinpoint exact causes of homelessness because it's often complex. But you can kind of conceptualize it as individual level and system level factors. So at the individual level, there's mental illness, substance use disorders, lack of stable income and employment, history of incarceration, lack of social support, and also adverse childhood events. Now at the system level, there's lack of affordable housing, lack of economic opportunities, neighborhood factors, and also cultural factors. And these different combinations of individual and system level factors that interact with each other. And so we did a study to try to characterize the different ways that these factors can exist and coexist. So we did a study of over 100,000 homeless veterans, and we identified 4 major risk factor profiles.
Oftentimes, we might be thinking about the veteran homeless population as they're all a group that has similar characteristics, but reality that is not the case. There's different groups or characteristics within the veteran homeless population. There's a group that has relatively few problems, a group that has both substance use disorders and another mental health condition, a group that has substance use disorder, incarceration history, and poverty, and a group that has a disabling medical condition. With this knowledge, we're able to do multiple things. One of them is to target interventions for that specific veteran. So for example, the veteran group that has relatively few problems, they would probably benefit from a rapid rehousing program that has short-term subsidies for housing, while the other 3 groups would probably benefit from more housing support, more intensive medical care, and other wraparound services. And thus, when we're thinking about our solutions to homelessness, they need to be tailored to the individual veteran's need to be able to lift them out of homelessness.
After leaving the Marine Corps, I was employed for 23 years with the local grocery company in the Loss Prevention Security Department. And in 2019, my wife was diagnosed with progressive brain disease, which currently has no cure. It's only treatable with medications or surgery. And unfortunately, there was complications that arose from that, and it left her disabled. She's no longer able to speak, walk, or eat on her own. She's totally dependent now. So I had to leave my employment to become primary care taker for my wife.
Mr. Jimenez came into Endeavors. He told me his story about what was going on with him, that he was homeless and with his 2 children living in his car. So immediately I tried to rapid rehouse him. So I tried to engage with family to see if they were willing to take the family in. That was not an option. It was not feasible for me to put him in a shelter because shelters were already at capacity. Our solution was to place him in a motel. We started working on his housing stability plan that prioritized his needs. Once we did that, we submitted the referral for HUD-VASH.
Collaborating with organizations such as Endeavors that help the veterans get connected with the VA is critical to the success of dealing with veteran homelessness. In the HUD-VASH program, we assist veterans in ultimately having permanent housing that are facing homelessness, and we also help the veterans with supportive services such as addressing substance abuse, mental health, physical health, intimate partner violence, unemployment, essentially any needs that the veteran has. In Mr. Jimenez's case, it really was about connecting him with the housing voucher so that they could have permanent supportive housing, and that would alleviate the stressors that he was having financially for his family, so that he could focus on caring for his wife and his children and less about, where will we live, how will we afford this home.
Knowing where they started and the crisis that they were in and the challenges that they were facing and seeing them now today, it's wonderful to see the family reunited, mom back home, and just being a family all over again.
Trying to do it all on your own is overwhelming because one, you're trying to navigate through whatever turmoil you're going through, and then to try to find resources, sometimes you may just feel overwhelmed and lost, but knowing, hey, there is assistance out there, and don't be afraid to ask for help.
The causes and effects of homelessness are just multifaceted. It takes a number of different services, people, providers, because each veteran is a unique case. A veteran may need health care, a veteran may need job development, A veteran who's experiencing homelessness or in unstable housing may just need a house, a stable, safe environment with which he can live. So it's extremely important that the services we offer are multifaceted, designed to meet the needs of that particular veteran.
I spent 12 years in the United States Army. Later on in life, as I got older, my life went into a spiral. I didn't know what it was, and that scared me. 2 years ago, I was at what I consider almost like the lowest point of my life. Me and my little dog was in the woods. I said, man, we can't stay here. And somehow I knew if you just call the veteran hotline, tell them where you are and what's going on, they gonna help you with everything.
So when the call came in for Mike, I could tell that he was extremely nervous, very fragile, and at risk. After calming him down and explaining some of the procedures that we do and the services we provide, I contacted my colleague, Jenny Carpenter, and gave her his general whereabouts and the phone number that he had given us. At that point, Jenny went out, found him, engaged him in such a way that he went with her to Haven for Hope that day, which put the icing on the cake for him, because that was the day that we moved him from being homeless in a field to Haven for Hope and on his route to HUD-VASH and to independent living.
You know, I think that it's always amazing when you're able to bring a community together. It's one of the things I love about our city, that we have community resources to help veterans, and we work together. With Mr. Ford, the Haven for Hope Veterans Navigation Team worked really fantastic with him. They helped him get his IDs and everything such as that, his paperwork. And from there, one of the community resources that we had is the San Antonio Metropolitan Ministries. They have a rapid rehousing program, and we're able to find Mr. Ford housing very quickly. And since he had his paperwork, we were able to easily get him a HUD-VASH voucher, and they started assisting with his rent.
We have an outstanding relationship with the VA, especially with the HUD-VASH program. For rehousing services, I help veterans that are legally homeless with deposit assistance and initial rental assistance to get them permanently housed into a place of their own. And I also provide financial assistance for those that are facing eviction and or utilities disconnections. We also can do what they call wraparound services, where we can provide a welcome kit, we can provide a bed, we can provide other necessary resources to ensure that they are moved into an apartment that becomes their home, instead of just four walls and a door.
When I got the keys to my own place, I could sleep in my own bed. I could just close my door and the world was outside. Inside was my face, my space, yes. That made me very happy, and that gave me more incentive and more drive. You keep doing what you're doing. But it wasn't just the housing. I needed therapy for PTSD. And that counseling portion really helps you address yourself, because there's a reason why you got to where you were. Through the HUD-VASH program and the resources that they showed me, my whole life changed. Yes, it did. I don't worry about nothing, because I dropped my pride, I asked for help, and I got it.